So we wanted to talk about rhinoplasty after jaw surgery. We know that the nose can change a little bit based on how we move the jaw. We also know that different nasal manifestations or nasal obstruction can be the chicken or the egg in terms of how jaw discrepancies and deformities can occur. So with nasal obstruction and a lot of mouth breathing, this has been shown to create this vertical growth of the upper jaw where you see patients with a gummy smile, maybe a narrow arch or narrow maxilla, maybe an open bite, and maybe a small lower jaw. So we know that these things are related, and we know that when we correct things with jaw surgery, we also want to take the nose into consideration in terms of how it's going to change and how we can also benefit and open up the breathing and aesthetics. So there's various things we do during this jaw surgery to help set this up. So we will look in significant detail in terms of how the septum attaches to the upper jaw. We do certain modifications of the surgery to keep this stable. We do certain modifications of the surgery so that the alar base or the width of the nose does not overly widen. We do things to help open up the lower 10 or 15% of the nasal cavity, particularly on the bone, what's called the piriform, which is the opening into the maxilla, removing part of the nasal septum that's on the floor of the maxilla, and sometimes widening part of this, sometimes addressing the turbinates. However, we're not really addressing the upper 85% where there can be significant septal deviation. There can be internal nasal valve collapse, which is that part of the nose on the outside where breathe right strips help stent open components of the midvault, it's called, of the nose. These things can all be addressed later. Additionally, we know that the nose can change in its appearance related to the jaw surgery, and we want to both aesthetically optimize the nose, put the tip in the appropriate position, open up the nostrils, make sure the alar base is the appropriate width, which is typically in line with the medial canthus, so the center part of the eyes, make sure the bridge of the nose is smooth, and make sure that the breathing is as good as possible. So we want to consider these things part and parcel. The critical things are that the nose should be done after the jaw surgery typically. In some cases, we'll do it at the same time, but the reason I prefer to do it in a staged fashion is twofold. Number one, because we're changing the foundation of the nose by moving the upper jaw. We want that to be stable, and we want to predict exactly the moves and changes we need to make with the nose. The second reason, which may be more important, is that when we do jaw surgery and you have tight rubber bands for a week, it can be difficult to breathe through the mouth, obviously, and we don't want to also do nasal surgery and place any type of splint in the nose. It can make it difficult to breathe there too. So for those two reasons, we typically will do the nose surgery later, and the average time is anywhere from 3, 4, 6 months after jaw surgery, which is a good time to do this and consider this. People will notice immediately after the jaw surgery their improvement in breathing, and doing the nasal surgery will be icing on the cake, where this will improve this even to the next level. And from an aesthetic perspective, we can really put the nose in balance with the rest of your face. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com.
Thanks again.